practical programs that we can be able to deploy that allows all of us to see value. So that's the general context under which we are having these conversations. And I think for us as a county government, the success is not just attendance or just talking, is being able to come out with tangible outcomes that probably next year we can come back and report and say, this is what we discussed last year. These are the things that we've done in terms of programmatic interventions or collaboration between the ecosystem and the county, and this is what we've been able to do. We might not be able to achieve everything 100%, but at least we can be able to say we tried and we've been able to move the needle a bit forward. So allow me to now introduce the CC for Health, Ms. Susan Silantoi, to just give her opening remarks. Karibu sana waziri. Can you give her a clap?
All right, good morning, everybody. I know it's a very chilly morning, but I hope you're all energized to talk about healthcare. All right, so my name is Susan Silantoi, as Victor said. I'm the CEC in charge of health, wellness, and nutrition. And I'm really honored to be part of this conversation at Innovate Tech Week. I think, Victor, your team has done such a good job to put this together, and as a county government, we're very proud of you. As you may know, IT has been at the forefront of health for quite a while. And today I just want to highlight two main areas. So first, we'll talk about some of the health interventions that IT has helped us with. And then also I'll talk about the school feeding program, which currently falls under nutrition. So in terms of technology, it's been at the forefront of medical advancements and transforming the ways we treat, we diagnose, and we prevent diseases. So as a sector, we've made tremendous strides. And I'll talk about interventions both by the county government and the Ministry of Education, Ministry of Health, sorry. So to begin with, I'll start with some of the interventions that we've had for TB programs, tuberculosis. The first one is digital adherence technology, which we call DAT, to support adherence on patients undergoing TB treatment using medication sleeves and labels. We also have video directly observed treatments, that's video DOTs, for patients taking drug-resistant TB treatment outside the county, and also within the county hospitals and outside. Third, we have something we call the TB-LITs, T-BULIT systems. This is the use of phones to register patients by healthcare workers online at the point of care. And yeah, so we use it with the TBU system. And I know my chief, Irene, will also expound a little bit more on that. So TB is a very big problem that we have, particularly amongst patients who are HIV positive. So that's one of the ways that we're using technology to cure that. In terms of HIV, some of the programs that we have adoption of point-of-care cloud electronic management record systems because of the high volumes that we have. So that's one of the things that we're using technology for. And then, of course, there's a lot of WhatsApp groups. I know that might not be considered a really high-tech technology, but it's big for the support systems that it creates for the patients that have HIV. In terms of community health programs, I know we have community health volunteers. This is a network of, they're practitioners now because we pay them, but this is a network of community doctors who operate outside our healthcare facilities. So they actually go house to house, household to household, and they're responsible for a certain number of households. So you'll find in areas like our informal settlements, they're the first point of contact for medical care for anybody. So we have about 7,000 of them in the county. Who take care of just about 3 million people. So in fact, if anyone is about to give birth, it is the CHV who would know. If anyone has TB, if anyone has any sort of illness, it is them that they will know first. And then they're attached to different health facilities where they make referrals, and then that's how most of the people get treated. So you can imagine those are 7,000 people that we need to keep track of, we need to keep their data, who have data that they need to keep uploading. And so with our community health promoters, we are using our community health reporting system, which is an electronic system that has been introduced in partnership with UNICEF, just to enhance community data. So that's one of the interventions that we're doing. And then, of course, we use our online training platforms like mJali to train these community health promoters using our mobile phones. And they receive training in emerging health issues, particularly when we have crises like COVID and cholera. So those are part of our critical healthcare workers and the systems that we use to just be able to mitigate that. In terms of health promotion, with the Ministry of Health, we use the Jali WhatsApp chat box to disseminate quite a number of messages. We are also working in partnership with UNICEF, particularly when we need to send out bulk messages concerning a specific crisis, probably when there's COVID. Currently, we're dealing with an outbreak of cholera. And we're in the second phase of our oral vaccination. So just to sensitize people, we also use quite a bit of our bulk messaging technology to just be able to reach out to most people. In terms of immunization, we have introduced a child immunization e-card to track child immunization. Currently, that's working in Makadara. It also sends reminders to caregivers. This could be mothers, guardians, just to remind them that your child is now due for vaccination again. So that's just one example. I know my chief will talk about a little bit more of that. I think we also, the use of the chanjo.go.ke during our COVID vaccination. That's also another platform that we use for immunization when we're all getting our COVID vaccines. So those are some of the highlights of just some of the technologies that we're using. Of course, currently at City Hall, we are moving to cashless payments for all our services, including our health services. So again, that's another use of technology that we're currently trying to use. We are in the process of trying to get a health information management system that will allow us to track quite a number of things. One, particularly in the facilities, just to track the customer journey to make sure that when the customer comes in, they are queued on the line, they are seen by a specific practitioner within a period of time, which we can track. They're moved from station to station, whether it is from outpatient to the lab to the pharmacy, probably for admission. We can track all that through our HMIS systems. And then, of course, they're billed and they pay cashless. So that's part of the interventions that the HMIS will look into. Secondly, HMIS will help us track commodities. So as you know, we have a network of about 118 facilities in Nairobi. It's more than the national government has. So we have to keep track of how we are supplying all our commodities. We have to keep track of how they're being used, keep track of what is being used fastest, what is not being used, and just management of that commodity system. And then thirdly, of course, we have human resources. I think healthcare is, the health sector actually has the biggest staff members. I think we have about 4,000 compared to all the other sectors that have much fewer. Victor, mko wangapi? You're like 5. Anyway, I'm kidding. But yes, so we have 4,000 healthcare staff, both medical and non-medical. And so again, the HMIS system will allow us to track within the facilities and even just to make sure that people are going to work, they log into work, they're actually seeing the patients. We can tell the number of patients that they've been able to see. We can tell if they're efficient, if they're not. And then that just allows us to deal with some of the issues that a lot of you complain about, particularly on Twitter. Maybe there was no doctor, probably there was, you went and you were not treated, or it took forever. So technology will help us particularly in that bit as well. Now, lastly, I'd like to go into our school feeding program. How many of you have heard about our school feeding program? By a show of hands. Except my county team. Yes, so as a county, we are embarking on a feeding program, which we're calling Dish in a County, where we intend to feed students in ECDE and primary schools in public ECDEs and primary schools, beginning 28th of August. That's end of this month. And we're going to be feeding about 250,000 children progressively. And you can see that's a really big number of children. One of the reasons why we're doing the school feeding program is because I think about a third of children miss school because of food in Nairobi. I know that sounds a bit foreign, but really urban poverty is one of the most hard-hitting kinds of poverty. You know, like in the rural areas, if you walk around, the fence is probably a mboga, a vegetable, sorry, for our international audience. You'll probably find a fruit along the way. Maybe you have an auntie or an uncle who lives somewhere close by. So food might not be the most rare thing to come by. But in Nairobi, really, if you don't have money, you really don't have food. And quite a number of kids are unable to afford food. I know you can ask me, well, there's probably some sort of feeding program that exists. There are quite a number of them, but on average, the food would cost about 60 to 100 shillings per meal, which is not affordable for most parents. So what the county is trying to do, we're employing a hub and spoke model, whereby we have a central kitchen that distributes food to the schools nearby. So when we have a hub and spoke model, we're able to produce in bulk, reduce the cost of food due to the economies of scale, and then as a county government, we subsidize, and then have the parent pay 5 shillings. So we've reduced the cost of food to just about 5 shillings per meal. A lot of feeding programs would also have your kids pay for the meals in advance at the beginning of the term, but for us, we will pay as we go. So if it is a 5 bob that you have today, that is what you will give us, and we will be happy about that. I know you might ask, why are we charging? Well, free things are not always taken seriously, and a lot of times they're wasted, and this is based on research. So the 5 shillings is just a small commitment from the parent. And for those who don't have, we will also work with the schools to identify actual needy cases that we will need to support, and we will support them. So basically, we're feeding everybody. That's just what I'm trying to say. So you can imagine those are 250,000 people. We have to keep track of all those people. We have to make sure that in all the 210 schools, everybody is eating. Now, we have to employ some sort of technology for that to work. So we are working with our development partner called Food for Education, who have developed a platform called Tap to Eat. So what happens with Tap to Eat, we're able to, 1, make payments, but 2, also keep track of the students. So we'll be monitoring quite a number of indicators to ensure, first of all, to also see if this thing is working, but also to ensure that everybody is eating, and then we keep a record of all these kids. So part of the records that we will keep will include performance, attendance of children, and of course, enrollment. And we're working with the Ministry of Education just to tighten all our gaps in terms of data, so we're able to keep track of all our kids, make sure they're all eating, but also keep close monitoring of how they're doing. In addition to that, because this is also a nutrition project, we will keep track of their nutrition indicators just to make sure that their growth is monitored, and we will give nutritious food, and we will measure to see whether this nutritious food is actually helping them in the growth. So we're employing that technology to just be able to make sure that the program is effective and works as it should. So I just want to say that even as we're doing this, I know there's quite a number of things that are happening. There's the hackathons and people who are actually using technology to solve very real problems. We have quite a number of issues as a sector, particularly data management. We still have a lot of frontiers in discovering what else can we do with our medicine, how else can we revolutionize how we diagnose, how we treat, and how we prevent diseases. And so even as we have this conversations throughout the week, we look forward to what solutions will be brought out of these conversations, and we will probably be your first customers in your innovations. So thank you so much for making time for this, and I do wish you a very good week, even as you continue to innovate. Thanks.
Asante sana Waziri for giving an overview of the health sector within the county. And I think Waziri has reiterated the commitment by the county government of Nairobi to work together with different ecosystem players within different sectors. And I think even His Excellency, the governor, had indicated that the county government is willing to be able to be the first customer for any innovation that is coming out from the ecosystem. Ideally, currently we don't have a model where probably we can be able to engage, because usually whenever we talk about government, it's always about open tender, procurement, etc. So I mean, for me, one of the outcomes that from this particular session is, can we be able to explore financing models or ways in which we can be able to collaborate to ensure that these types of innovation get into the county. Next up, I would want to introduce Dr. Irene Muchoki, who is the Chief Officer, Medical Services and Acting Chief Officer, Wellness, Nutrition and School Feeding Program at Nairobi County. It's a mouthful. I mean, it's a huge title. It's the weight is on you. So, karibu sana, Chief. Maybe just to again just give a bit of context around medical services, challenges, successes, etc. Karibu sana, and your address for the weather. Karibu. Can give a clap.
Thank you, Chief. Good morning, everyone. I'm happy to be here. Thank you, Chief. Despite our busy schedules, but all is well. My name is Dr. Irene Muchoki. I'm the Chief Officer of Medical Services, and also in acting capacity, I'm the Chief Officer of Nutrition, Wellness and School Feeding. I will not belabor what Waziri has already said because she's given us a good oversight. But overall, I'll speak about health because we can't, there's a very fine line. Huh? In fact, we call it a thin line. Sometimes we don't even have, we're not very distinct in our subsectors. However, overall, health is big. Health has a lot of opportunities for innovation, for uptake of digital expertise, and currently, much as I'm under medical services, we also have the public health. Overall, we divide health into public health and medical services, but in our setting, we have 4 subsectors. However, wow. I think this is the sector that you need to take advantage of when it comes to innovations. One thing, because in health is very dynamic. It evolves very rapidly. And in fact, I keep saying, if a health worker does not keep in touch with the changes, they get lost somewhere. You'll find yourself to be, outdated. So with technology and health, they go hand in hand. Currently, we have different, a lot of ways of how we manage our clients when it comes to interventions, like in medical services, surgical interventions. We have new technologies on how to, for instance, carry surgery. We look for non-invasive ways and minimizing the invasion of the humans when they were carrying out surgery. So we use a lot of non-invasive methods to take care of our patients. And that is all technology. Looking at
what I'm looking forward to learn is the essentials of cybersecurity, and most importantly, get to learn about the policies that have been set in place, or policies we're looking forward to see in the future, especially in our country, and also that will help us learn and combat cyber threats that come up in the industry, in business, market, and also in the tech world. Thank you.
All right. I'm curious, do you have a background in cybersecurity yourself?
Building the capacity, but I'm doing a software engineering program right now.
All right. Thank you. We love to see people like you.
Thank you.
Okay. One more comment. I hope Dr. Bright, Fraser, and the rest, you're all listening. We have 2 people here at the front.
Good morning.
To you too.
My name is Zedi. Okay. What I desire to get in this session is to get some insight on what to expect in the future in terms of cyber security and cyber defense, and how I can maybe position myself as a profession in cyber security.
All right, so
Thank
you want to get into the career?
Yeah.
Okay, that's the right place you're at.
Good morning, everyone. My name is Pauline. I'd like to know if we are ready to tackle the cybersecurity issues that we've been experiencing, and which we will definitely experience in future. Like, are we really equipped enough to tackle it and to prevent it from happening in the future? And also, I'm here on behalf of my sister, so I'll just listen in because she's doing IT and trying to decide whether she'll do cybersecurity or something else.
All right. You know, this session is for everyone, whether you're in IT or not in IT. For example, on Monday, as Africa Hackon, together with SheHacks, we were training some young children aged between 14 and 18 in terms of child online protection. So this is something not just relevant for the IT professionals, but something also relevant for us, our families, our homes, our children, our parents, our grandparents, because online security is very, very important. We live, give or take, almost 90% of our time online nowadays. I mean, I probably left my phone somewhere and it's online. I'm actively receiving WhatsApp calls, video calls and all that. So it's really, really critical to have this knowledge. So for those of you who don't have a technical background, IT background, don't worry. The guys who are going to be speaking in front of you today have you covered. Yeah? So otherwise, thank you so much, ladies and gentlemen, for giving your input in terms of what we look forward to hearing today. So without further ado, I'd like to now give you a bit about how we'll be running today's sessions. So we'll have 4 major speakers. The first speaker shall be Anthony Muyoro. He's a partner at Deloitte East Africa and in charge of cybersecurity in Deloitte, which is one of the big 4, one of the largest companies. Yeah, clap. Thank you. Next, we have Jacqueline Mbuthia, cybersecurity engineer at Africa Hackon. Clap. Then we also have Fraser Kilonzo, co-founder and cybersecurity engineer at CyberGuard and Africa Hackon. And finally, we have Dr. Bright Gameli, cybersecurity engineering lead at Mara and founder of these guys here, Africa Hackon. And these guys are just not knowledge specialists just here in our country in Kenya. These guys lead in terms of their knowledge sectors across the whole of Africa. So I really, really can't wait to hear from them. So to kick us off, I'd like to introduce our first speaker, Anthony Muyoro, to take over the stage. Again, this is a very free session. So if you feel the urge or the burning urge to ask for a question, please just raise your hand. And I'm sure a good friend Anthony will allow us to give you a chance to be able to talk. So Anthony, the floor is yours.
Good morning, everyone. You all doing well? You're very quiet. How are you guys doing? Fantastic. I want you to look at your neighbor and tell them, let's talk cyber. Great. So as you've heard, my name is Anthony, but my friends call me Tony. So I'm just going to do a quick intro to set the tone for the amazing sessions you're going to hear and we're going to have from my good friends, Dr. Bright Fraser and Jackie. So now, why is this important? How many here have ever been a victim of a cyber attack? Or you suspect you are a victim or something has happened? Show of hands? No? Okay, 2, 3, very good. Keep doing what you're doing. So some of us, we learned this the hard way, but pretty much I'm just going to talk about why this is important and why this conversation has come to the fore. I'm sure you're all aware. Recently, I think a few, probably, is it a week now? when Kenya we had a massive cyber attack that really happened, right? And it was all over the place. And the reason why this is important is so that you can understand this is no longer that isolated issue that happens maybe when you go to a cyber cafe and then there's a virus that downloads to your USB or something like that, right? But the stakes are higher. Now the actors have also become, very motivated, well-funded, well-orchestrated. So again, some of them are actually political actors, and I'm actually going to talk about that later on. But to paint this picture, why are we having this discussion of cyber risk? And what does this landscape look like? Now, I want to focus on one truth. Fundamentally, we now, as an industry, we now say that every 39 seconds a cyber attack typically normally happens, right? Because again, the tools of trade, we're in that digital arm race. Everything that we're using now is highly digitized. So now the risks that now comes with that digitization is where now cyber attacks become, very widespread, right? So now for this, and just to paint this picture, obviously over the years, and when you look at your news, typically you'll hear of some of these things that happen. Sometimes you hear in US or Russians hacked China, or you'll hear a bank that was hacked. But until recently, in fact, and I was telling my friends back there, right now is actually the perfect time to talk about cyber in Kenya, because we have the perfect use case. What really happened when we had the distributed denial of service attack. And just for context, I'm aware that not everyone is a techie here. What a DDoS is illegitimate services or service requests being sent to lock out legitimate users, right? For instance, you're trying to get in that door, and then you'd have an army of people who try to come in so that you're blocked out of that. So what that happened is that many people were not able to obviously access the services. E-Citizen was affected. We had M-Pesa. Apparently, it was also affected, among other ones, right? Now, what is the impact to that, particularly to a nation like Kenya? And I was looking at a few statistics. Right now, every day, we have around $207 million worth of transactions every day on M-Pesa. Yeah? In fact, M-Pesa is actually equal to some of the countries' GDP, some of the smaller countries' GDP. So you can see the systemic risk of that particular service, right? Because if M-Pesa is actually down for like a month, what would be the impact to our economy? It's massive, right? So, and that is a scale when we talk about, the importance of cybersecurity, particularly today. Not only for big organizations, but I believe even for small businesses and even at an individual level. Today, you obviously are using, on average, and I can see many young people, on average you have how many apps that you actively use on a day-to-day? 5? Between 5 to 10? Probably your Uber, M-Pesa, your bank, Facebook, Twitter. So on average, this can be 10 that you use on every day. But the ones that are, in your phone, typically it would be like between 20 to 30, right? If I'm not wrong. People like Fraser probably has like 50 or 70, yeah? Because again, that is actually the demographic that we see. But then, cyber risk has become a big issue for many organizations today, for many businesses today, as well as many governments today. Let me go back to my example, the use case that we have. What happened in Kenya? We had what we call nation states. And these are politically motivated actors that have an active